afternoon. This video is for Rare Disease Day 2024, which happens to be on February the 29th because we have leap year this year. Well, I just wanted to let you all know that I made this video to just show that the common person, even some healthcare workers, have never heard of Rare Disease Day or truly know what a rare disease is, even if they are treated commonly. Like in doing this video and researching, I found out that sickle cell disease and cystic fibrosis were rare diseases, which I never would have thought that those were. But going back to me, like I said, I have several rare diseases. I have gastroparesis, in which I am on TPN for. That is a disease that you will find more women have than men. I also have mast cell activation syndrome, in which I am treated by an allergy immunology doctor for that. I have primary immunodeficiency, in which I also see immunology for that as well. I am currently on IVIG treatments for that. I have had HLH in the past, which is hemophagocytic lymphohistiocytosis. Not many people have heard of that at all, and it is quite rare, but I was thankful that my hematologist recognized the symptoms and I was treated so I did not need chemo to get rid of it because mine did eventually resolve. I also have Ehlers-Danlos, which is a connective tissue disorder, and dysautonomia. And what I have found is that a lot of time you will see people that have a lot of these comorbidities together, such as Ehlers-Danlos, dysautonomia, mast cell activation, and sometimes even gastroparesis. I just wanted to bring awareness to let people know that there are people out there like me, that there are a whole lot of rare diseases. In the United States, over 200,000 come up with a rare disease, I believe, yearly. But there are many rare diseases out there. And just because a disease is rare does not mean that only one person will have that disease. You still may have 10,000 people with it, 100,000 people with it, 200,000 people with it. And I believe currently there are over 10,000 rare diseases. And something else I just wanted everyone to know is that rare disease mascot is the zebra. And I don't have on a zebra shirt, but I am wearing black and white stripes on my shirt to let you see that I can show my stripes. And I hope that if you have a rare disease or if you are a provider that deals with rare diseases, that you continue to bring awareness to these diseases so other people know about them. And please don't discount someone who believes they have a rare disease. If the symptoms are there, please do the research, get the testing, get the genetic testing if possible to find out what is going on with this patient so we can cut down on having to wait years for treatment. I hope that you'll watch this, check out all the different interviews, and see the infographics that I have listed here. Again, happy Rare Disease Day to all you zebras out there. Thank you. Hi. Do you know what Rare Disease Day is?
I do now.
Can you tell us?
The last day of February.
Yay. Do you know why that is Rare Disease Day?
Because it doesn't happen very often.
True. What signifies a rare disease?
Less than 200,000 people have it?
A year. Do you know of any rare diseases?
I do.
Can you let us know some of those?
Cystic fibrosis, Ehlers-Danlos, mastocytosis. Let's go with that.
Thank you for your help. Hello. I just wanted to ask you, have you heard of Rare Disease Day before?
No, I have not.
Do you have any idea of what it is?
No, he's doing paperwork.
Do you know what signifies a rare disease?
No.
Do you have any idea of what sort of diseases may be considered rare?
No.
Well, thank you. Hi, and thank you for helping me today. Question for you. Do you know what Rare Disease Day is?
Yes.
What is it in your opinion?
In my opinion, Rare Disease Day would be a day that is observed for diseases that are not commonly known to the public.
Do you know when that day is?
I'm assuming it's today, February 21st, maybe? But I don't know.
Okay, thank you for your honest opinion. Do you know what signifies a rare disease or any types of rare diseases out there?
No.
Okay, thank you so much for your help today.
Thank you.
Hi, and thank you for helping us with this interview today. My first question is, do you know what constitutes a rare disease?
A disease that affects fewer than, not specifically, not by definition, but I know it affects a small population versus the majority.
Correct. Do you know of any rare diseases?
Ehlers-Danlos,
Yes.
gastroparesis. There's a few of them. I guess those are the first ones that popped in my head.
All right, thank you. Do you know when Rare Disease Day is?
No.
It's in February.
Today.
It is actually the 29th this year, which it's in February because February, shortest month, has the rare number of days and all of that.
Yeah.
One last question. Do you know the rare disease mascot?
No, I do not.
It's a rare animal.
A rare animal. I don't know.
Zebra.
Really?
Yes. In medical school and health, people are taught to think hoof prints,
Yeah.
not, stripes. Think about horses, not a zebra.
Yeah.
Because zebra, you rarely see one.
Yeah. Very
Yeah.
cool.
Is there anything else you would like to share with us that you may think goes along with rare disease awareness?
Not that I can think of. No.
Okay. Well, thank you for answering those questions and helping us to bring awareness.
Very good. Thank you.
You're welcome. Hi. Have you ever heard of Rare Disease Day?
I have not.
Do you know what signifies a rare disease?
I do not.
Have you heard of anything that you think might be rare? Like, did you know that cystic fibrosis was a rare disease?
I did not.
Hi. Hi, and thank you for joining us today. My first question for you is, do you know what makes a disease a rare disease?
No, I don't know what makes it a rare disease. No.
Do you know what some rare diseases are? Can you name a few rare diseases?
Gastroparesis or primary immunodeficiency.
Okay. All right. Do you know when Rare Disease Awareness Day is?
This Friday? I don't know what that day is.
February 29th.
February 29th.
Why is rare disease in February? Do you know?
Because it's the only month that's odd. Like,
Well, that's
the
pretty
same
good.
numbers?
It's because February is the month with the shortest month, and then February has leap year, which is a rare occurrence.
Oh.
Is there anything else you want to share about rare disease, or do you know what the rare disease mascot is?
It's a zebra, right?
Yes. Do you know why?
No. Is
Okay.
it the stripes?
Yes, because commonly people are told, you know,
Black with white stripes?
or your zebras are a rare occurrence, and people with rare disease are not something that people see every day.
Okay.
Thank you for joining us today. Hi. I just want to ask you a few questions today about rare disease. The first question is, do you know what a rare disease is?
A rare disease is a disease that affects less than 10% of the population, or I think it's 200,000 individuals that have the disease.
Good. Do you know when Rare Disease Day is celebrated or observed?
I do not. I feel like it was this month, right?
Yes.
I do feel like it was this month because I have a patient who has a rare disease, and she educated me.
Nice. It is this month. It is February the 29th, which is considered the most rare the most rare day.
Yeah.
And so it's a leap year, so it's February 29th, but normally it's the 28th. And my final question is, do you know of any rare diseases?
So I do have a very close friend whose son had a genetic rare disease. He was born, I don't really know the name of the disease. I remember it had numbers in it, but it has to do with your eyes and the rods and cone dystrophy in your eyes. Found out when he was about 14 months old, and started getting him tested. He started going to Bethesda, was seeing specialists all throughout his childhood. A lot of vision problems, like he was declared legally blind. When he turned 18, he received a phone call from one of his doctors from Bethesda, and was offered the opportunity to be the 9th person for a life-changing surgery that took 18 years for him, right?
Yes.
To get. And he did go through with the surgery, and at the time, he was the 9th candidate that had the surgery, and at the time that they were doing it, the surgery had been 100% effective. And so as number 9, this was probably a year and a half ago, because I think he's coming up on 20. It has been effective. It is a long duration for healing, but his vision has improved. He has had to have his glasses altered multiple times. He can now see in the dark.
Great.
Which is huge for someone that was unable to see at all. So
that's great.
Yeah.
Do you know of any other rare diseases?
I know quite a few people, and I don't know if EDS is considered a rare genetic disease.
It is.
Okay, so I have taken care of a lot of EDS patients that,
need physical therapy.
Definitely physical therapy, and a lot of them have been military.
Yes, I have learned that too. I have found a lot of military people online that have Ehlers-Danlos. So Yes.
Yep.
Wow.
Trying to think anything else. I mean, I'm sure so when I get diagnoses that I'm not familiar with, I'm always doing research to see how to best treat.
Yes.
And a lot of times there's nothing to guide you in a treatment plan because they don't have enough information on them. So I guess in those cases, those would be like rare diseases, or just limited treatment options.
Yes.
Or information available. I have went to the NORD website and the genetic and rare disease.
Yes. For the
sites
National
before.
Institute of Health.
Yes, but sometimes there's no options for treatments unless you're looking at infusions or
Yes.
something. But as far as from a therapy perspective, there's no. I mean, basically, you go with symptomatic. Like, what are they symptomatic of, and you address the symptoms. So.
Yeah. Well, thank you so much for your interview.
Absolutely. Thank you for having me.
You're welcome.